Hi, this is Dr. Deborah Ekstrom, Associate at Orange County Plastic Surgery. Today we're going to talk about fat grafting, and fat grafting can be done all over the face, in the hands, lots of places to restore fullness. And it's the ideal filler because you own it, it's yours, it's completely biocompatible, and once it's grown into place, it tends to stay there, especially when you take it from a space that is storage fat on your body and move it to a place that's destined to lose it, like your face. So your face is pre-programmed to lose fat, and that's kind of unfortunate because it's what makes us look gaunt, makes our skin hang, and in addition, the bone gets thin in your face. Tissues, you lose tissues in your hands, but people especially notice it in their lips. And if they're thin-lipped to start with, that can be a bit of a problem because now their lip starts to disappear. So lots of patients like to have fat transfer to their lips. Sometimes we bring the chin forward with it, and this is an area in your face where you lose a lot of fatty tissue around here. So the lower face is a great place for fat grafting if you have enough fat to move. Right here we have a picture of a patient who's had fat grafting to her lips, and let's go right now to see if we can make this same sort of thing happen in the operating room. So let's go to the operating room and look at what fat grafting to the lips looks like, how it's done, and see what you can see on the operating table for the changes. This patient is here in the operating room asleep now. You can see her endotracheal tube here breathing for her while she's asleep. And we're going to be putting some fat tissue in her chin. She doesn't look like how wrinkly her chin is. And then she's getting lots of lines around the corner of her mouth and her lips. So chin, around the mouth, and the lips today is what we're going to do fat grafting. The fat goes in just through a little poke hole here. Real easy, that'll never show. And it doesn't take that much just to revolumize the face. She hasn't lost that much, but we're destined to lose the fatty tissue in our face. So I'm going right between her chin and her lip there to fill that, just like that. And she doesn't need her lips too big, but now you can see she's got a little definition. Same thing with her lower lip here. She's got a little definition. The lines are filled in a little bit, and the corner looks better. I'm gonna put a little bit more in her upper lip. I think she needs more volume than that. It's still too thin. About 70% or a little bit more of this will take. We'll grow blood supply within the next 10 days or so, because it's a true grafted tissue. And you can see it there. And now I'm going to go your lip goes around the corner here. You can see how it goes around the corner, and that's a important area to keep full. Right like that. So now her upper lip is nicely filled, and I'm going to go a little bit into her upper lip here because she doesn't like the way the lines look up there. She looks in a really shadowy light. She doesn't like the way that looks. So we're going to fill that just a little bit. So we're going to go a little bit into the white lip here. Just a little bit of graft in there to make that good again. And some people do lip lifts in this area, but I think if you put the volume back in, that sometimes you don't need that. So we're going to go back around to the other side now and do the same thing. Okay, going on the right side here now. Here we go. And again, we're going into this whole side of her lip. We're going to create that pillow. So here we go with the pillow. And you can see that filling as it goes along. And I've got little clogs. I'm going to spit that out. And here we go. A little bit more in there. I'm going to put just a little bit across the center so it doesn't look like it's deficient. We're going back up into the top now. Right up into here, into her top lip. We'll need more than what I've got left in this syringe, but a little bit right there. right up into it. I'm going to put this little cross. I want some right in the middle there. That little, we'll call it a tubercle, but it's a little, that pretty little piece that is in the middle of the lip. It hangs down in some people. And this needs more fill. It's not enough yet. And I can feel that it's not got enough fullness in it yet. All right, that looks pretty good. She's got a nice peak here, not as much on that side. We're gonna give her a little bit more. I'm gonna give her a little poke just to work this. We're gonna do some work on her nose. I'm just gonna give her a little poke right on her lip here so I can lace some right in that peak. Right in that little column there. And give her a pretty peak right here. And a little bit in this column as well. Right here. She's got plenty in the tip of that, but she needs some in the column. And go right up in there. Give her a little, and I can feel that going in between my fingers. There we go, a little bit more. And it just flips her lip up really nicely, like we sometimes do with Botox, but you can do it with filler. She looks to me like maybe around this area a little bit needs some more, now that this is normalized. So just feather that in so she doesn't look normalized in one area and it doesn't match with what's around it. And there's fiber in that fatty tissue around there, so it takes a little push to get through it. So her lips aren't too big. I think they're going to be really nice. She looks a little full right there, so I'm going to blend this as well. So she doesn't look gaunt and then look like she's too full. And I think we're just about done here. And that's how we do microfat grafting here in Orange County, at Orange County Plastic Surgery.